Ever think, man, I wish I knew that sooner? Trust me, you're not the only one. I'm Allyn Rose, and welcome to Learn Too Late. Dr. Sweeney, thank you so much for being the first guest on our Learn Too Late podcast and kind of being the guinea pig for this, seeing if we can pull it off. So I asked everyone on TikTok, on Instagram, what are questions that they had, thinking that, you know, maybe they've had a couple cocktails, you're their girlfriend. What are like the TMI, embarrassing, like slide in your DMs, asking for a friend style topics? Because I think our oral health is something that we don't really talk about, but it's so important, as you know, for our overall health. And I don't know if it was our kind of boomer parents, or maybe things have just changed so much in the last 30 years that I feel like we're all just sort of shooting in the dark, hoping that we're doing enough. And there's just a lot of misinformation out there. There's a lot of brands who are trying to sell us things that we might not need, or actually might be hurting us. So I would love your insight on that. Why you think that, you know, we as sort of millennials and the sort of age, like we feel like we don't really know what we're doing when it comes to taking care of our teeth. And that sounds really crazy because all the other parts of our body are taken care of. Like, why are we so, I think, ignorant about our own oral health?
Yeah. Well, first of all, thank you for having me. I appreciate it. There's definitely no stupid questions. I have these conversations with my patients, friends, all the time, because just as you said, even for me, there was so much stuff that I didn't know even until I went to dental school, honestly, which is crazy to think about, that there's just so much misinformation or lack of information. And I'm grateful for the fact that I think that that's changing. I think at the foundation of a lot of it, it stems from just people's lack of knowledge, but also I think it stems from the fact that the like foundational overarching like education on it, just even from the standpoint of like medicine and dentistry, like those are separate entities just in schooling. So I think right there, for years, the mouth and the eyes, like you have separate insurances for that. You know, it's always been looked at as like a separate part of your body, which is crazy because it's not. So I think for so many people, they were always like, oh, it's just a tooth, you know, it's just this, it's just that, like, and it wasn't because it wasn't a part of traditional medicine, that it was looked at as like this outside thing that didn't really matter. It was just like an aesthetic thing. But really what we know and understand now, and what is being understood more and more with all the research and everything that is coming out, is how interconnected your mouth is to the rest of your body, and vice versa, that like your mouth is the gateway to the rest of your body. So what you're putting into it, of things that are going on in your mouth, how much it affects the rest of your body, and how much the rest of your body affects your mouth. So it's definitely not like, people shouldn't be ashamed of that. I think at the core of it, it's been an issue for years, and unfortunately it's taken to this point for a better understanding to happen. But I'm grateful for the fact that it is happening now. People do care. People want to know. So I have these conversations daily, you know, with my patients, with my friends, to help people really understand, because I get it. I was in the same boat, that there was so much I didn't know until I learned for it firsthand. And not that everyone needs to go through dental school to understand that. So yeah, I'm glad to help.
Well, you've a very impressive resume. So before we dive in, I kind of want to introduce our listeners to who you are, and why I thought you would be the absolute perfect fit to talk on this. So I'm just going to read your beautiful bio here. Dr. Sweeney received her Doctorate of Dental Medicine, Bachelor of Nutrition, and Certificate of Public Health at the University of Pittsburgh School of Dental Medicine in Pennsylvania. You practice comprehensive general dentistry with a focus on cosmetic dentistry. And this one I love in particular, smile design, as well as Botox and fillers. We have to get into this part of it.
Yeah.
That piqued my interest right away when I read that. So you are using your knowledge and skills in nutrition and dentistry to deliver individualized and patient-centered care. I saw that you own 3 practices with your husband. You're involved with Project Smile, and close personal connection. You also competed in Miss Florida and Miss Pennsylvania, USA. So I feel like the pageant world is so small. We're all sort of interconnected somehow. So a couple of pageant girls had recommended you to me when I was looking for a position for this. So it was perfect.
Yeah.
You're always working on helping people get their Hollywood smile of their dreams, which, you know, somebody who's worked in the industry, all about that. Very, very important. So a lot of people, when I had talked about wanting to do this first episode, because I haven't really shared completely the theme of the podcast yet. So I wanted to give a little introduction before we jump right in. So I personally have had issues with my gums for the last probably 20 years. And I think that started out just because I wasn't flossing well enough. But I just felt like I'm too young to have gum recession. This is crazy. And I was going to dentist after dentist. Some people told me it was genetic. Some people said that I just needed to floss more. But when I made those big lifestyle changes, I was flossing more. I was doing all the things. I bought the most expensive toothbrush. I was doing everything. And it hadn't made a difference for me at all. And it really wasn't until my husband went to a new dentist, he dragged me along, that one of the hygienists kind of saved my life. And she said, oh, instead of, just flossing to death, why don't you try interdontal brushes? And I hope I'm saying that right. But literally within 2 weeks, I didn't have any gum inflammation anymore. All of the plaque buildup that I had, like my receding gums went away. And it was one of those sort of shower principle moments of, man, I learned this too late. Why was nobody there to tell me about these little things that maybe could make the difference?
Right.
So I wanted this podcast to sort of be, I was today years old when I learned X, Y, and Z. And I think dental health is something that a lot of people feel ignorant about. They feel a lot of shame about it. They feel scared to go to the dentist. So I am so excited to be able to chat with you and get sort of the expert opinions on all of these questions where people really just don't know the answers. And we're sort of piecing things together either by becoming Dr. Google or seeing things on TikTok or your videos on, Instagram, etc. So I wanted to warm our audience up, so to speak, with a quote from one of your sort of recent viral videos where you said, I'm just warming you up to tell you that brushing your teeth without flossing is like wiping your butt cheeks without wiping the crack. So tell us about that. Why is flossing so important? And then also, why do you think those interdontal brushes worked for me when the flossing didn't?
Yeah. So a lot of people don't think of things the same way that they think of flosses. You're just kind of slightly like cleaning between the teeth, but like not really necessary. The way a lot of, and understandably so, the way a lot of companies market things, even just toothbrushes, yes, they do reach really great areas. And I love my electric toothbrushes. I'm through and through an electric toothbrush girl. But some of the marketing really, if I didn't know any better, I'd be like, is this cleaning everything? It's reaching everywhere that I need it to, right? Because of how they market some of these things and some of the claims that they make, which are not always true, as we know, just across the board from any marketing perspective, right? So the reason why it's really the same is what I always tell people is when you eat and drink all day, every day, that bacteria in food starts accumulating around your teeth. And you can kind of even feel it. That's why when you eat, some candies or more processed foods, you kind of feel that like weird film on your teeth. And if you leave that bacteria keeps feeding on that. That's what starts causing gum issues and cavities and all of that stuff. But really the main purpose of flossing is to get those small crevices, between the teeth, to actually really mechanically clean under the gums, to clean off, the remaining percentage that your toothbrush couldn't clean off. So that's really where that mechanical cleaning ability to really remove that bacteria that causes gum issues, that causes inflammation, bleeding, cavities, all of those things that can be a problem for someone. And that's why, it's a funny reference, but why people remember that is really when you go to the bathroom, if you're missing those crevices, if you will, you're missing a big portion of things that it's going to cause an issue down the road. Granted, with your teeth, people don't notice it as much as if you weren't wiping properly, right? So that's why it's, a funny reference of a way for people to really understand like what's actually happening. Like food is decaying in your gums and you have debris and stuff that's left there that's really going to get really stinky. And, that's one of the big issues, that not only gum disease and cavities, but it can cause bad breath, all of those problems. And then I know you had the question of why those brushes may have worked better for you. Tough for me. I can't say, for sure without, seeing someone's, mouth and seeing everything intricately. But what I will say is some products work better for each person. And that's why when I treat my patients, it's always an individualized approach, because it's not that maybe flossing wasn't working at all, but there could have been, in your specific mouth, maybe you had more spacing between the gums. Maybe there was, something that it allowed those brushes to get in there a little bit better, or maybe in your hand specifically, it worked better and you were able to reach areas where maybe with your flossing, you couldn't reach as well or didn't feel like you could reach as well. So all of those things are different. I always really try to make sure that I know and understand what products are out there on the market. Of course, we can't know everything, but the more we know it and understand it, there are more tools in our tool belt to be able to utilize for our patients.
I think a next question that we had was, what can not flossing do to us long term? Because I know I have some dentist friends and they're always sort of joking, like, we know if you're not flossing your teeth. We all like to lie to our dentists. Of course, I'm, flossing twice a day. I'm doing, all the things. But we know.
Right.
So what is something that maybe you could say or inform listeners to let them know why flossing is so important? What does it do to us long term? Because I think that's something that's sort of tough. We get into our like late 20s, early 30s, and that's when we start caring because we're seeing the effects of not taking care. So maybe your parents didn't floss or you just, it's not really that big a deal. I'm brushing my teeth. Like, how can this actually affect me long term? So what happens if we don't floss? If we have gum disease, gum recession, what's the end game that's going to motivate us to be doing this once, twice, 3 times a day?
Yeah. So there's a long list of things that can happen or can be issues if someone doesn't get into that. So what I always tell my patients or people that I know is I'm like, listen, when you're younger, same thing with eating habits, right? You could eat McDonald's a ton when you're younger. Most of them are not really going to start seeing effects until you're in, late 30s, 40s. And if you're eating McDonald's every single day, most people are going to start seeing issues, see diabetes, some see high cholesterol, see different things on the rise now from these habits from years ago. Same thing when it comes to our oral health is that, and we'll talk specifically about flossing, is that if you're not flossing, early on, again, our body rebounds pretty fast. You have different bacteria and different levels of things, at different ages and for different people. So that's why some people notice effects much earlier in life than other people, because there's genetics play a role, your diet plays a role, your habits play a role. Like there's so many things that go into that, which can make it kind of confusing. But in the short of it, for your oral health, if you don't develop those good habits, it'll first start leading to inflammation, bleeding, what we call gum disease. You'll get more accumulation of bacteria and stuff around the gums. Again, most people, gum disease is a silent disease. So most people don't notice that it's a problem until they start either noticing bleeding, they start feeling sensitivity on their gums, start feeling pain, or in some people's cases, when it gets really severe, that teeth actually become loose. Because what happens is, if you imagine I have like a sleeve around my arm, if that's your gum tissue and this is your tooth, over time, as bacteria accumulates, it first starts pushing those gums open, digs deeper or basically tunnels under the gums and actually starts eating away at your bone, which is the foundation of your tooth. And as we lose bone, your gums eventually follow. So that's why people start noticing teeth start looking longer, things start happening. And because that bone is being lost, teeth actually will start to become loose. So that's just in your oral health effects long term of it can lead to you losing teeth or losing all of your teeth in severe cases. And it's really sad when we see that, but I've seen that many times over. And on a larger perspective of your overall health, the bacteria that can cause advanced gum disease, or what we call periodontal disease, they found that there's the same inflammatory factors in the same bacteria that actually is linked to heart disease and hardening of the arteries and clogging of the arteries, not to mention things like diabetes, a bunch of other systemic issues. So they're finding a huge link between oral health issues and systemic issues that are all preventable problems. So I think if the mouth issues are enough to get someone to want to care, then your overall health, because if someone has diabetes or heart disease or has a family history of that, they're at much higher level of having more issues. All that is to say, there's a huge link between so much of systemic issues and other issues within the body and what's going on in your mouth, especially gum disease.
I think dental health is one of those things as well that once things start going downhill, then you start getting anxiety and you're nervous about going to the dentist or you feel embarrassed. Why do you think that people are so scared of going to the dentist? That's just sort of like a trope we have. Oh gosh, we're going to
Yeah.
the dentist. I know my dad personally, he's 70 years old. He's kind of scared to go to the dentist. And I had a couple people reach out to me and say, hey, I was scared as a kid and I got laughing gas, but they don't
Yeah.
allow that anymore. What are some things that people can do if they have anxiety that can help them get through that and into a doctor's chair so that they can fix the issues they have?
Yeah, absolutely. And that's as you just said, that's one of the biggest issues that actually keeps people away from the dentist is their fear of what's going to happen, their fear of, maybe they had a bad previous experience. And I probably get almost every day get somebody in the office that is their story. They either had a bad experience in the past with a previous dentist or, just something that happened that has deterred them, or they're just afraid of what they might find out and that's kept them away. So I always tell people, like, the important thing is when people enter the chair, I always tell them, I'm like, the important thing is that you're here now and we're gonna get you back on track in whatever way that we can. With things, it's not, I never think it's something that people should be embarrassed about, no matter how long that they've been away for. The point is that we're starting, right? So at our offices, we utilize, Netflix and TVs on the walls and on the ceilings. We use noise canceling headphones. We have, blockout masks. We have, essential oils and hot towels and different things to make people feel as relaxed as possible. We have those little like fidget, spinners and the fidget toys to help people. There is laughing gas available. There is, oral medications that help with that. So there's a lot of different tools that can be utilized for patients, but I understand that when I was a kid, I had a dentist who didn't use gloves, didn't use anesthesia. I remember crying in the chair as a child, being like absolutely terrified. And that's one of the things that made me go into dentistry, is I didn't want someone to feel the way that I felt as a kid and be terrified of the dentist. So it's an understandable thing, and it's unfortunately a very common thing. But I think we're hopefully seeing a change and a shift in that to change the way that people think about going to the dentist.
Well, as a doctor, what is the best way to speak up when you're having an issue? Because I feel like the dentist is kind of like going to the nail salon. Like, even if you hate it, you're like, it's great. I love it. Thank you so much.
Yeah.
So I know that I've been in the chair and I'm a pretty outspoken person in a healthcare setting, but something hurts or it's uncomfortable and you're just sort of grin and bearing through the pain. I know as a doctor, you don't want that to be the case for your patients.
Right.
So what would you say is the best way to speak up or to tell your doctor either I'm in pain or I feel uncomfortable so that no one is feeling pain or anxiety or anything at the moment?
Yeah. And this is where I think, unfortunately, it's something that needs to happen on both sides of it, because as a doctor, one thing I always do is I always make sure my patients are numb before I start anything. As silly as that might sound, I always like test around the area and I'm like, do you feel anything? Do you feel this? I like make sure that someone's completely numb beforehand so I know we're starting off on a good foot. The other thing I always like to say to my patients is, hey, you're going to feel vibrations. You're going to feel water if we're prepping a tooth for something. Like, that's normal. But if you feel any sensitivity at all, you feel any pain, or you just need a break, I'm like, just raise your left hand. So that's something that even if your dentist doesn't ask you those things, a very easy, and I know people don't always feel comfortable saying like, hey, or like, I need to stop, or saying something, and we're working in your mouth, right? It makes it very difficult to do that. But, oftentimes just like raising your left hand, minorly can like indicates for us as the doctors or for our assistants, like someone should be able to see it to be like, hey, okay, something in some capacity, something's going on with this person, that whether they're, having pain, they're having something, like just a brief like lift of the hand is probably the easiest thing for someone to let them know, like, hey, I'm feeling anxious, I'm worried about this, just the more we know, the easier it is to make it a more comfortable experience to patients. But yes, on the side of the patient, it totally can be hard with that. But, when you're laying back, just, a brief like lift of the hand indicates to us something is happening. We need to stop for some reason, whatever's going on with someone.
I feel like this is a dental business opportunity to have like a red flag with a tooth on it for like your
Like, hey,
patients to raise. Make it easy. There's no like timid hand that's being raised. Like you've got your red flag, green flag.
Yeah, that's true.
The number one question that I had, and things that I know that this is terrible, but like doing my research on like dentists on TikToks and things like that, is the right order for taking care of your teeth. And this is something that I definitely learned too late in life. And my husband had to sort of teach me what are the right steps.
Mhm.
So for anybody listening, what would you say is the right order for brushing, flossing, mouthwash? Like, do you brush before you eat your breakfast? Do you brush
Mhm.
after you eat your breakfast? Is there a length of time? Like, what's that perfect setting? Like, if you're a dentist and you're giving somebody the
Yeah,
rundown,
yeah,
like,
yeah.
what's an ideal patient for you?
Yes. And this is what I'm going to say. You will definitely get debate on this. This is the unfortunate thing where they say you ask 9 out of 10 dentists, 9 out of 10 dentists is recommended on the brand. This is where you will get some debate on it. I will go from the standpoint of what I've seen through all the research, thus far. For me, this is what I tell my patients and what I stick to is when it comes to the brushing, flossing, all of that stuff, flossing before you brush. Now, when it comes down to it, if someone is flossing twice a day, every day, whether it's before or after your brush, is not going to make or break anything. The fact that it's being done is the most important part. Now, there's a lot of studies to show that flossing before brushing is after a little bit is actually better because you're able to remove what's in those like crevices under the gums
Mm-hmm.
and then brush after. But like I said, if someone really loves flossing after the brushing, that's okay. It's not, I promise it's not going to absolutely make or break anything, but it is better to floss. Or if someone's using a water flosser, I always tell them it's best to use your water flosser first, then your floss, then go in and brush. And when you're brushing, most toothpaste that someone's using has an anti-cavity ingredient in it. So you want to let that sit on your teeth for as long as possible. So, you can spit it out. For some people, if it's a weird feeling, you can spit, rinse, and then rebrush over that to allow the anti-cavity ingredients to sit on your teeth for longer, because that's what is helping fight off the cavities. So that's kind of the best order to do that. In terms of before and after eating with breakfast, in an ideal state for someone to brush before having their breakfast or whatever meal that it is, and then brushing 30 minutes after. I know that's not always realistic for people. The reason for that is after you eat or drink anything, especially anything other than water, the pH of your mouth naturally decreases. So if someone can only do one or the other, and they don't have time to wait 30 minutes after, I would tell them brush before they have their breakfast. And then if possible, brush 30 minutes after eating. But I know that's not always, possible. So if it's not, at least rinsing after using xylitol mints or a more basic mouthwash that has an anti-cavity ingredient like fluoride in it will be beneficial for that. But yeah, the ideal is before and after, but there's that caveat of the 30 minutes after, which I know can be a little bit tough for people.
So another question that we had that was, what do I do with drinking coffee? So people were saying like, hey, like, I drink my coffee, like I know it's acidic, but I want to brush my teeth right away because I don't want to have issues with staining. So what do we do with things like red wine, coffee, things that could stain our teeth? What's the best way to go about either like eliminating the stain in the first place or doing something to like get those materials off of our teeth so they're
Yeah.
not getting in there?
Yeah. So I'll give you what the most ideal is, knowing that some people might hear this and be like, okay, I'm not doing this. But this is truly, if someone wants the best of both worlds and what's truly going to help with all that, brushing your teeth actually before having your coffee, having some of those things is going to actually help less of the stain adhere to the teeth. I know it might,
Interesting.
I know it might actually like, same thing with like orange juice. It could alter the taste of that. So most people might not want to do that beforehand, but that will actually help prevent as much of the stain causing ingredients to adhere to the teeth, because now you don't have the same like plaque on the tooth. So the surface is more clean. The other thing with it is with coffee, wine, any of those things, if you can drink it in one sitting, and within usually about 15 minutes. Now I'm not telling people to chug their, chug their wine and stuff, but when it comes to coffee, what I tell my patients, if you can have it within 15, 20 minutes of drinking it and then rinse with water right after versus sipping on it throughout the day, you're not getting that acid exposure. So it's going to be less issues and less coating on your teeth, less chance of harming your teeth. But also when it comes to your teeth, it's about exposure. So you're not constantly rinsing it over with that stain causing ingredient consistently. So if it's kind of in that, it's when it comes to your teeth, whether it's for cavity risk or for stain causing, it's more about the exposures and versus the actual amount that you're having. So the shorter time period is going to be better if someone is willing to drink it through a straw. That's going to be the most beneficial because you're avoiding those front teeth as much as possible. Again, no, it's very weird, especially if you have hot coffee. Drinking wine through a straw is not always ideal. But those are all things in an ideal world where it's going to help with that. Rinsing right after and utilizing, xylitol mints or gum in that in-between period. Because again, we're going to want to wait that 30 minutes before brushing because again, these are more acidic things that we're having in our mouth. So anytime we have acidic food or drink, you don't want to brush right after because you're actually kind of brushing that acid into the tooth and more prone to causing wear on those teeth. But yeah, that's kind of like the ideal. I was actually talking to someone the other day. Now, I haven't found this product yet myself, so I will let people know if I do come across it. But someone was telling me about, I don't know if it's a rinse or what exactly it was that they said they saw that it's supposed to help coat your teeth before you have, coffee or wine or something like that. I haven't seen that yet in terms of helping avoid the stain causing. I'll let you guys know if I find it and it's legit. But those are my recommendations at this point that I tell people to help avoid as many issues with your teeth and causing stains from those, coffee, tea, wine, all the things that we love.
So all I'm hearing is that like moms are screwed because we're in that stage of chronically like never getting to drink the coffee when it's hot, warm it up in the microwave.
I know.
Well, this is, I think, the perfect segue for pregnancy related questions with your teeth. And so I'm 36. I've got 2 little kids. I have friends who have gone through, all kinds of issues, really tough pregnancies. So one of my friends is in the DMs saying that she has chronic morning sickness, really terrible. She's throwing up like 10, 12, 15 times a day. She wants to know, should she be brushing her teeth after every time she throws up? Does that hurt her teeth if she does it? And then how can she sort of mitigate the issues or acid sort of problems of like vomiting so often? And pregnancy is already hard on your teeth. Like what do you do in that case?
So not only during pregnancy do you have all the fluctuation of hormones, which already is making someone more prone to gingivitis and some of these things just naturally within the mouth because of what the hormones are doing, creating more of a dry mouth, creating more of an acidic mouth. So I always tell my female patients, before they get pregnant or when they're pregnant, like if you're at, 80, 90% with your hygiene when you're pregnant, you got to be at like 150%. I know it's not fair. And that's kind of what happens. And then in terms of the, dealing with morning sickness, rinsing right away after, I know it's going to be very hard to not want to brush right away, but as you kind of see the trend, you want to wait at least 30 minutes because your mouth is so acidic from that stomach acid from vomiting. But what you can do in that in between is A, rinse with water, B, a mouthwash that is an alkaline, meaning it has a high pH. That is going to be a good in between to not only get that like just nastiness taste, feeling out of your mouth, but also it's going to help kind of neutralize the pH of your mouth. So there's a couple of them. My 3 favorites are TheraBreath. They have a light blue one that's great for bad breath anyway, but that is a very alkaline mouthwash. Act has a 0 alcohol fluoride one. That is also an alkaline one that has a anti-cavity ingredient to help with that as well. And there's another one, which I am blanking on the name right now. Give me 1 second because I have it here and I want to know what the name is.
Yeah, we can also add it in the podcast description and link it out so that if anybody out there wants to get the right mouthwash, because that was a big question that we had too, like, is mouthwash good for you? I know some of them aren't. And then that's also a part of the steps. So again, I just saw this on, Dr. TikTok, but there was a big creator talking about how she learned that you're supposed to mouthwash prior to brushing your teeth or doing those steps instead of what you see in every single, commercial out there. You brush your teeth, you floss, you do all the things, you do your mouthwash, walk away so you have the fresh breath for your date. Like, is that good for you? Is that bad for you? What's the mouthwash sitch?
Yeah. And Elementa is the third mouthwash.
Elementa, so okay, perfect.
Just in general, so all mouthwashes are not created equal. And that's why I don't love mouthwashes. I think they're not a necessary step. So if someone isn't using mouthwash, they don't need to necessarily start using a mouthwash. Across the board, for most people, if someone likes it and wants to use it, it's a great like intermediate step. When it's been a while since they're brushing, they just need a quick freshen up. It's a great to use at that point in time. The 3 that I mentioned, the Act 0 alcohol, the Elementa, and the TheraBreath, all of those are known like alkaline pH is up, meaning that it's safe for the teeth. There's a lot of studies coming out showing that with the amount of, let's say, if, like the anti-cavity ingredient, with the amount of that's in that versus the toothpaste is kind of the same, and now you're kind of rinsing it out. So it's actually better, like your friend said, to use your mouthwash ahead of time than floss and brush after. So for me, I really only use mouthwash sometimes in the morning to kind of get that, bad taste out of my mouth, like initially before I go in with my tongue scraper, floss, then brush. They're not all created equal. So someone doesn't necessarily always need to use them, because unfortunately a lot of them and a lot of the very well known, I won't mention, specific names of it, but some of the very,
I'll say it.
some of the very well known ones are, my mom is a diehard through and through of the brown one, but it's super, super acidic, has very high alcohol in it. So it's just all things that you kind of don't want in your mouth, because a lot of the alcohol can disrupt your oral microbiome. So it can actually kind of start destroying the good bacteria in your mouth, which makes you more prone to bad breath, to dry mouth, some of those things, not to mention it's very acidic. So you're washing your teeth over with acid. So that's kind of why you'll hear different discrepancies at this point with mouthwash. And that's kind of the reason why is there are some good ones out there for sure if someone likes it and wants to use it. But as a whole, is it a necessary thing that someone has to add into their routine? Definitely not.
So you mentioned tongue scraper, which I feel like is the BDSM of the dental world. Like every time I see them, like it just looks like some kink device. So tell us about tongue scrapers, why it's important. I've added this to my Amazon cart after going through your videos. I know that I need to get it. So tell the listeners why it's important, how often they should be doing it, when to add that into our step, mouth routine.
Yes. So, and I feel like even for myself, I feel like in dental school, they didn't talk about tongue scrapers. They didn't talk about some of these things. But one of the biggest reasons why people experience bad breath or a bad taste in their mouth is because you can brush and floss your teeth, which is super important. But your tongue that's lying right in the middle, that is like basically just a big like pad for bacteria to hang out in if it's not being cleaned. So just like you brush and floss twice a day, we need to be cleaning our tongue ideally twice a day, removing that just food debris that accumulates, the bacteria that accumulates there, and cleaning it off as best as possible. The reason I highly recommend the metal tongue scrapers is because they're going to last you way, way longer. They're much easier to clean. Those like plastic ones are the ones that come on the back of the toothbrushes that have like finger-like projections on the back. Someone can definitely utilize those. The downside of them is they accumulate the bacteria. They're very hard to clean. They don't last as long. So the metal ones, you can toss it, a minimum once a week, even every couple days, you can toss it in your dishwasher. It's very easy to clean with soap and water. They will last you a very, very long time. If someone doesn't have, or doesn't want to spend the money on a metal tongue scraper, you can use a metal spoon that you definitely have in your kitchen. Just, I would take it out of rotation, of your normal eating and reserve it for that. But that's the reason why it's so important to clean your tongue, is because bacteria and food debris just sit on there and accumulate all day. So if you're not cleaning that, it's going to be a huge source of bad breath for someone.
So am I calling myself out if I'm like, I've always brushed my tongue with my toothbrush? Am I just like putting extra bacteria from my tongue into my brush and then brushing it back in my mouth?
So that's where like it's better than not cleaning your tongue at all, but it's definitely better to have a separate thing for it. So that's where, if you got down to the nitty gritty, there might be some people that are like, oh, it's the same bacteria in your mouth, but that's why it's more effective to be able to clean with something like a tongue scraper on your tongue, and then have your toothbrush for brushing your teeth. Now, there's ways to sterilize it and do some of these other things, but yes, it's more ideal to have a tongue scraper to clean your tongue with. That being said, I do have some people, it does take a little bit to get used to, because you kind of want to drag from the back to the front. And for some people, it can, initiate their gag reflex and have more issues. So I do have some people that find it easier to utilize.
So it is a BDSM tool that you guys.
For some people, it might be, right? But yeah, it's always, anytime I make videos on tongue scraper, it always reaches a different side of the audience, that we're intending to. But what I would recommend is if someone doesn't like the tongue scraper and wants to use a brush, it's better than not using anything. But I would recommend to use a separate toothbrush for that, just so that way you're kind of able to keep that a little separate.
Okay, so moving on to vibrators. And by vibrators, we mean electric toothbrushes. Is it important that I have an electric toothbrush? Are all electric toothbrushes the same? Are they different? Do I need the super, super high-end one?
Mhm.
What do you recommend?
Yeah, so the electric toothbrushes are going to be more effective. I forget the percentage. I want to say that there's studies that show that it's like 80% more effective than the manual toothbrush. At the end of the day, I do have some patients who they can't tolerate like the feeling of the vibrations. At the end of the day, whatever someone is going to use is going to be the best toothbrush for them, because if someone's not going to use an electric toothbrush, then it doesn't make sense. But if we're coming down to one or the other, electric toothbrushes are always going to be better. Now, are they all created equal? No. Do you need the highest end toothbrush ever? No. At this day and age, most toothbrushes from Oral-B, Sonicare, some of those have the Bluetooth setting, which links up to your phone or another app that actually can show you how well you're brushing. You don't need all the bells and whistles. What I would recommend for most people is get one that does have a pressure sensor on it and a timer, so you know how long you're brushing for, and make sure that you're brushing for the 2 minutes. And ideally get one that has multiple settings, just so that way, if you are more sensitive, you can have a lower setting versus the ones that just have the one speed. They're still good. So if that's, all someone can do or all they're looking for, that's okay. Those are still good toothbrushes. It will be very effective, but sometimes it can feel a little too powerful if someone's not like used to the feeling.
I'm worried about this Bluetooth setting. I feel like this is just another way to like shame myself. Like my phone's giving me the alert that I have like too much screen time. Then it's also like,
It's
you can't fucking brush your teeth
yeah.
either.
It can be humbling even for myself. I was when those models kind of first came out, I was still in dental school, and I remember we were gifted some of them from some of the brands, and I tried it, and I was like, I for sure got this. Like, I'm brushing long enough. Like, I'm doing this right. Like, I know how to brush my teeth, right? Literally instantly lit up red. Like, was saying I was brushing way too hard. And I was like, oh my gosh. Like, so I don't use the app part of them. I definitely don't use it daily. My mom does, so like all power to her for that. But it is very interesting, like, to use for a short period of time for you to see, like, oh man, am I favoring one area more than the other? Like, am I actually cleaning everything properly? Am I brushing too hard? That's why I really love the light sensors, because even for myself now, it's very easy for us to be in a rush or like to be so stressed about things. And then all of a sudden, even as a dentist, I'm looking and I'm like, oh my gosh, my toothbrush is lighting up red. And like, I don't think I'm putting too much pressure, but it visually shows you that you are. The timer is great because even for myself, I was using a new toothbrush that I had that has like a countdown timer on it. And I was like, oh, I feel like I'm like, gotta be close to the 2 minutes. I looked and it was like a minute and 10 seconds. So like for me as a dentist, if it's easy for me to miss, it's totally easy for, someone who's new to their, oral health journey and getting things on track. So not that it's something someone has to use every day, the trackers, but it's definitely a great like learning tool to see how, like, what baseline you're at for stuff.
So this is very quickly turning into a sex podcast. So for anyone out there who has a shame kink, get the Bluetooth toothbrush to tell yourself how inadequate you are. Well, I'm going to do a couple of audience questions, sort of like rapid fire ones.
Yeah.
What are the best things we could do? So one of our questions was, are floss picks as good as regular floss? Why or why not?
So traditional floss is still always going to be better and more effective. Couple reasons. One, the floss picks, I always tell someone, if it's the difference between them flossing and not flossing, use the floss picks. But it can't adapt quite as well around the teeth and under the gums, because for most people, like I said, a lot of people are just snapping it in and out. You actually need to get under the gums a couple millimeters and make like a C shape around each tooth to be effective. But not only that, the string floss, you can get a clean piece of floss every single time. The floss picks, like the floss is about this big on it. So you're reintroducing that bacteria that we're removing into those spots every single time you go in. So when it comes down to it, traditional floss is always going to be better. And not only that, it's cheaper as well, most of the cases. So you're also saving money on that front. But again, if for someone they're like, listen, I don't know how to use it well, it's more technique sensitive, I'm not going to use it, use the floss picks. I would rather have someone do that a million times over than not flossing at all.
Okay. What is the best way to keep your breath fresh? And what do you do if you've got a last minute date and you can't brush your teeth? How do you make sure you get all those food smells, garlic, whatever out of your mouth?
Yeah. So, on the most simply put, using your tongue scraper, brushing, flossing properly, that in and of itself is going to eliminate bad breath for most people. Drinking enough water is super, super important to not only a healthy mouth, but helping to eliminate that bad breath causing bacteria. So staying hydrated with that. And then if you're not able to, brush and floss, you're not able to get into that, xylitol mints or gum are going to be really good to help with that. I also, as silly as they sound, those little, I can't think of the brand, I want to say it might be by Colgate. They have like these little mini brushes, which I think are really cute to keep like in your purse, your car, your pocket, something like that, that like you can very quickly on the go. It's not going to, you know, replace your brushing, but it's a great like on the go little tool that if you need a quick little freshen up, maybe you can't get into a bathroom, you don't have the stuff with you. Those are really great little things to have, you know, with you when you need that quick freshen.
Okay, so I'm going to do a 180, and the last questions are going to be some like TMI spicy questions that I got. So I saw a reel that you did about spotting STDs in a patient's mouth. I want to know, is there any risk for you as a dentist if someone does have an STD and they're insecure about it? What do they do? Should they go if they have a flare up? Should they be seeing the dentist anyway? Should they wait until that goes away? What somebody who has, you know, maybe oral herpes or something do when it comes to the dentist?
Yeah, no, and that's a great question. So yeah, if someone has an active flare up and they're, let's say they're scheduled for their cleaning, it is advised that they wait until the flare up decreases, just because, yes, of course, like it can still spread if someone has an active breakout and they're touching things, whatever. So it is advised if someone knows that they have a condition like oral herpes and they're having an active breakout, it is recommended for them to wait until, you know, that flare up goes away for them to come back in. Of course, if someone doesn't know and we realize, and that has actually happened, where someone didn't know, they came to the office and while I was examining them, I let them know. So we didn't start any treatment that day. I let them know what was going on. We had the conversation about it. But yeah, so if someone knows, yes, definitely wait until that flare up or the active breakout is gone. Someone doesn't know, you know, hopefully the provider can recognize that and have that conversation with someone. But yeah, I mean, the risk to us, yes, it's there, but it's pretty minimal, especially compared to like what our highest risk things for us in the office as providers are. That's not one of the high end. We're taught to use, you know, universal protocols with things. So that way, whether someone has HIV, they have AIDS, they have, you know, like Hep B, they have some of these other big things. We're taught to treat things in a way that like we're trying to decrease our risk as much as possible as providers. But yeah, definitely not something that someone needs to be embarrassed about. You know, we deal with anything and everything, you know, in the mouth all the time. But yes, if someone is aware of that, there's definitely time that they can take off for that.
So is this a myth or not? I saw a video that said that dentists can tell if you've engaged in oral sex recently because there's some sort of like internal bruising in your mouth, things like that. So that's the question. I was like, is this real or not?
So yeah, yes and no. It is not a myth. We definitely, if someone, I'll say that this way: if someone is aggressively doing it, it will leave certain marks on parts of their mouth that yes, we can definitely tell. Now, could we tell for everyone? Not necessarily, but there definitely is. If we see certain marks, we know the weekend that somebody had.
Perfect. Okay, I saw recently a TikTok couple sharing a toothbrush, and this woman was so shocked that more couples don't share a toothbrush because they both swap spit anyway. What horrifying things is that doing to your mouth? What would you say to listeners who may be engaging in sharing a toothbrush with their partner?
Yeah, so for many reasons, I would highly advise against it. You know, for the same reasons that you shouldn't be sharing loofahs and other things, you know, with your partners and things that are, you know, going like things that can be excluded. I guess I'll say it that way. They're basically like you can transfer different things to each other. So even if it's something, you know, not necessarily cavities and gum disease, but even if it's something like a oral virus or, you know, oral issue, you can be transferring that to your partner. And not only that, but the bacteria that's, you know, if you have someone who's very high cavity risk and somebody who's never had a cavity in their life, if they're sharing a toothbrush, the person who has high risk of cavities is going to be transferring that bad bacteria to that other person, often that it actually can start causing cavities for that person because cavities are contagious. When we say that, what we mean is that the bacteria that cause cavities can easily be transferred, you know, from person to person or from, you know, horizontally from, you know, mother to a child if they're, you know, sharing food, sharing these other things. So that's why it's advised, just like anything, you want to not to share them. I understand that's, you know, you're kissing, you're doing other stuff, but you want to try to keep that exposure to a minimum when it comes to sharing oral healthcare products, just because you are going to be putting each other at risk for, you know, viruses, bacteria, any of the stuff on that front. And yeah, I think in general, just any hygiene care products are not really meant to be shared, you know, it's for self-hygiene. So
All right, last question. What is something that you wish more patients knew prior to visits? What's something that most people have learned too late that could help them or make an appointment go better?
Um, Man, I feel like there's a lot of things. When it comes to just them coming in, I think one of the things I wish that people realize is that the what each person's needs are can be different. So, um, some people might need to be coming in more than every 6 months for a cleaning. So and usually if someone's coming every 6 months, they'll kind of already know where they need to be at with things. But because that's oftentimes what people have in their mind is every 6 months or like annually, sometimes they get people who they're like, oh, I missed my annual cleaning, and now things are very, very, very far gone, when really they actually need to be coming a lot more often because of what's going on in their mouth specifically and the issues that they kind of have underlying. So that's something that I kind of wish people knew. And I guess as a blanket statement, it's just kind of I guess a better way to put all of this is I wish people knew the effects of not taking care of their mouth, what it would have, what the risks would be long term from them, whether that's letting a cavity go, having a tooth taken out too early, or just not taking care of their mouth properly, like what the effects were going to be. Because as you said, there are some people that unfortunately they come in and they start caring too late and things are too far gone. So, and that's always heartbreaking to me when I've had patients where I've had to take out every tooth in their mouth because the situation was just so bad. And I'm like, man, if we would have just been able to catch this, a couple years sooner, like we would have been in a very different place. So that's what I wish people knew, is they just knew the effects of not taking care of their mouth and what that effect would have on not only the oral health, their overall health, their quality of life, all of that sooner.
So this is your reminder, anybody listening, please schedule your dentist. It's not something to have anxiety about.
Mm-hmm.
You're not too far gone.
Yes.
Any problem can pretty much be fixed. So thank you, Dr. Renae, so much for doing this podcast, for sharing your wealth of knowledge. And I hope people are walking away feeling a little bit more confident about their dental health, and to, maybe go a little easy if they're having a fun weekend before they come to their dentist.
Yes. Well, thank you.
Not disclosing too much information.
Well, thank you for having me. I appreciate it.